going to be talking about how to manage your medicines during floods. So apart from shelter, apart from food, apart from the basic necessities like your clothing and all that, okay, medication shouldn't be overlooked as well.
Yeah, and it's often overlooked, especially when it comes to situations like this, because at the end of the day, truth be told, it's something that is actually very important, because we will think to ourselves that, okay, we can put our medications aside first, because we need food. We need water,
clothes,
we need clothes, so on and so forth. So medicines, if you are actually suffering from any sorts of diseases, you might actually tend to overlook it. And truth be told as well, you need help, right?
Definitely.
So it takes time for help to actually come your way. So therefore,
even
you're
when it
actually
comes our
risking
way, right? Like help, like even when it comes our way, it's usually just the basic necessities. No one really highlights or brings in medication.
Yeah, the only medicines probably you get is paracetamol.
Exactly.
Yeah.
Right.
So, of course, right now we are talking, like, let's say if you live in the area where you experience flooding throughout the whole year. We hope not, but of course, as often as compared to. So, we want to actually tell you and talk to you and talk to someone in the studio together with us how you can actually manage it better. And hopefully, at the end of the day, you can see yourself through. So, Erin, please.
So, we have, of course, an expert. We always have an expert here in the studio with us. We have Jessica SHUANG. Sorry if I'm pronouncing your name wrong. Am I correct?
Correct. Yeah,
okay.
correct.
I'm so sorry if I'm pronouncing your name wrongly. Pharmacist from HKL. Hi, Jessica.
Hi, Irene and Brandon. Thanks for having me today.
Thank you for
so
coming right here, our very cold and chilled out studio.
Yeah, we're really feeling chilly here. But I hope you didn't experience any flooding on the way here.
Yeah, still okay.
Definitely not, but it rained yesterday though. So I heard that actually yesterday Smart Tunnel was closed because to actually divert waters in Kuala Lumpur out of the city centre. But with huge amount of waters, of course, we're still talking about floods and the management of medicine. So it can be threatening and it can be challenging. So what are the implications about this?
The implications of floods on the health management of patients are wide-ranging, and one of them is the management and supply of medications. Often we receive complaints from patients claiming that they have difficulty to obtain the supply of the medications because the routes from their house to the healthcare facility has been cut off during the floods, resulting in them unable to obtain their refill of medications or unable to see doctor for the continuations of the medications. Then also there are some patients claim that they are not able to follow the schedule to taking medications because their medications are lost or washed away with the floods, along with their medical records and also the prescription. Therefore, these two will lead to non-compliance to the medication taking, and these are especially unfavorable, especially for those patients with chronic diseases, such as high blood pressure, diabetic, epilepsy, because non-compliant to the medications will lead to serious complications. For example, if patient is having high blood pressure, then they are unable to take their medications, it will lead to serious and life-threatening conditions such as stroke or worsening of their heart functions, and these are unfavorable. Therefore, patients living in the high-risk flood-prone area should always make early preparations to prepare them against a flood.
Yep, and talking about early preparations, actually, we also mentioned it as well. You know, we make early preparations for our basic necessities like clothing, food, and often medication is usually overlooked. At house, you mentioned, you know, if those are washed away or their hospital records, you know, their medical records is usually washed away in the flood or destroyed. So, what precaution or any steps that they can take prior to the flooding, you know, in those people living in the flood-prone areas? Like, what can they do?
Yeah, as I mentioned earlier, patients need to make early preparations because prevention is always better than cure. So the first thing is about the supply of the medications. Patients with chronic diseases should always ensure that their medication supply is adequate to last them throughout the durations of the flood. And also, in addition, the medications should be stored correctly at the correct temperature, protected from sunlight and moisture, and keep out of reach of children. Then, in relevance to the flood, the medications bottles or packages should be stored in watertight container or waterproof bag to prevent the medications from being contaminated from the flood water or rainwater. Okay, this is the first. Then secondly is the supply, is the storage condition, as I mentioned earlier. Then patients can also arrange for an appointment date with the doctors, which is after the flood season, because usually pharmacy will supply medications in adequate amount until the next appointment date. But this is also depending on the stock level of the medications at that pharmacy. Then, however, patients can always discuss for the pharmacy if they need extra amount of supply. And pharmacists will usually assess the need and supply the medications accordingly. Then another option is patients living in this area also need to find out what are the nearest healthcare facility that will remain unaffected during the floods, where they can seek for medical attention or to obtain their medication supply from. Then these patients can actually opt to use one of our pharmacy service, which is the SPUB, stands for Sistem Pendispensan Ubat Bersepadu. So have you heard of this service before?
No, honestly.
No.
Okay.
Yes, exactly. Is this an initiative by HKL as well? So they can actually look it up online when they visit the website?
It's actually a KKM initiative. Patients can follow up under let's say HKL. Then if they are living very far away from HKL, then they can use this service for their refill of the medications to be collected from another healthcare facility that is nearer to their house.
Right, fantastic. So you just mentioned about storage and you just mentioned about adequate supply. I just wanted to ask you, adequate supply, does it mean extra? But you just mentioned they can actually prescribe extra medicines. And then you also just mentioned that if they have stock, then yes, of course, they can get extra supply. But how do they move around here? Can they actually prescribe medicines? Do they need to bring proof? Do they need to bring, I don't know, some sort of proof to actually go to the pharmacy and say, look, I need extra medication because I want to prepare myself for floods?
In this regard, this is how it usually works. So doctor will usually prescribe the medications, let's say for a duration of 6 months, okay, until their next appointment date. Then pharmacy will usually supply medications either monthly or 2 monthly, okay, until the appointment date. Means patients have to come back like 2 or 3 times for the whole durations of the prescription.
Okay.
Then in this case, if the patients foresee that the route to their healthcare facility will be affected on the date of the refill of their medications, then instead of 2 months supply, then patients can discuss with the pharmacy saying that maybe they think that the date of the refill medications, the route will be affected, so can they request for 3 months instead of 2 months? Yeah, something like that.
So all they need to do is just talk to them and then this can be sorted out.
Yes, talk to the doctors or pharmacies.
Well, this is actually very interesting because at the end of the day, we're talking about the overuse of medications as well, right? But of course, with proper prescription and comes back to an individual, you don't
Definitely.
overuse your medicines.
Yes.
And of course, talking about this as well, because we're only talking about, not to say only talking about, but I also want to touch on, let's say for a person of an individual who requires medication on a daily basis, but they unfortunately didn't do early preparations and they were led to, they're facing the floods and all that. Is there anything that can be done to make sure they receive their proper medication? Or is there any access or any programs that maybe you can highlight to our audiences at home if they've not done any early preparations?
Okay, in case that the patient's house is affected by the flood and they are evacuated to the relief center, then they can always attend to the medical team on duty. The medical team on duty will always bring along the medications as well as the medical equipment to treat the victims. So the medical officer will assess the patients and prescribe the necessary medicine to the patients.
Is it only like basic illnesses, for example, like diabetes or high blood pressure, like how we mentioned? How about like for more serious illnesses?
For more serious illnesses, maybe the medications will be temporarily available at the relief center. However, the medical team is consisting of doctors and pharmacy nurses. So the pharmacists, if needed, they will sort out and find the source of the medications for the patients. Especially for those patients who really need the chronic medications.
Okay. So as what Erin just mentioned just now as well, we have like people, maybe unfortunately they're a bit too late to actually manage their medication properly. So in terms of like medication management, if you, let's say if you don't do early preparation and you're a bit too late, actually you're very late already, what can these people actually do in terms of like going to the nearest help, which is actually located with all the people who are in charge of actually helping you out. But while you wait for help, what do you do?
While you wait for help, means the patient's already run out of medication, is it?
Yes, correct.
Okay, so what I would suggest is for patients that already run out of their medications, then they should have their medical record with them. For example, their clinic kesihatan book or their hospital summary or something like that. Then they can go to their nearest GP or even their nearest clinic kesihatan to seek for help. Yeah, the doctors will go through the notes and prescribe the medications to the patients accordingly.
So if preparation is not done completely, the least you could do is to actually have your track record with you.
Yeah.
And let's save that, please.
Yeah,
Yeah, one
exactly.
method that I could suggest is actually patients or family member can use their phone to take the photo of their prescriptions and medical records to just in case to back up in case any emergency in the future.
Oh, that's another way of doing it.
Yeah, technology, right? Resort to it. It's the easier way. Anyway, we've talked about preparations to be done pre-flooding, and then we've also talked about preparations, what should be done when you experience flooding, and also how we touched on if, let's say, we're too late, too late to get our medication. How about post-flooding, when the flood recedes and everything, like what should patients do after that in terms of access to medication?
Okay, after the flood recedes, then the patients are advised to go to visit their nearest health facility to seek for medical attention and also to receive their medications. So the doctors will examine the patients thoroughly and prescribe the medications to the patients according to the patient's current health status. Then any lost prescription or any lost medical record will also be replaced. Then, then when the patients arrive back at their home, one of the things is maybe there will be some leftover medications at home. For your informations, medications that already been exposed to the flood water are actually not safe for use because the flood water may be contaminated with the sewage, with the industrial and agricultural waste, and is full of bacteria and viruses. So in any case that the medications have come into contact with this contaminated water, the ingestion of these medications will lead to serious infections such as leptospirosis, cholera, typhoid fever. So this medication instead should be discarded properly. Like they should not just throw into their garbage bin. These medications, the contaminated ones, should be passed over to the pharmacist of their healthcare facility for the pharmacy to dispose into the clinical waste bin. Then there are also some medications require storage at cold temperature, such as your insulin, eye drops, and some antibiotics in liquid form. So in the case of flood, there's a possibility that the electrical supply has been cut off. So result in the changes in the storage temperature, therefore affects the stability and safety of the medications. So these medications may not be safe for use anymore. So if any patients have any doubt about the storage temperature and safety of the medication, always ask your pharmacist first before using them.
So unfortunately, what we've just dissected is literally, you gotta prep yourself well, but if you don't, if you actually missed out that window, all you need to do is at least have that track record together with you, all right? So it's actually very important as we talk about this because, I mean, Jessica, we've got like stats coming in also as well. Just read and of course did some homework about this that said, of course, in flood-prone areas, you still, at the end of the day, you have people forgetting to prep themselves early or maybe even missing that window to actually prep themselves early. And it's actually life-threatening. Some actually have lost their lives. But right here in Malaysia, have you actually heard about cases like that in that stance where people come to you at HKL with all these kind of unfortunate news and circumstances? Have they actually been prepping themselves well? And what are the usual common, I wouldn't say mistake, but the most common reasoning that they don't prep themselves early? What are some of those that you would like to highlight right now so that our viewers at home, when they watch, they can actually advise their friends and family to prep themselves better?
From my experience, I've experienced patients admitted to ward because of uncontrolled blood sugar. Okay, then we ask why are you taking your medications accordingly? Then they claim that there's already not taking their medications for a period of time. Then when we ask the reason, then they will give us the excuse that their house is affected by the flood, then they are unable to get their medication supply and to see doctor. So this is very unfavorable because that patient actually goes into diabetic ketoacidosis, which is a very serious and life-threatening condition.
Right.
Yeah, I think one of the reasons that patients don't prepare early because some patients have poor health insight into their health.
Right.
So I guess family members really play a role in helping the family members, in helping the patients, especially those elderly patients, in managing their medications appropriately.
Okay, interesting. So we've actually covered a lot on medication during floods, before, what preparations you should do, after as well, and also during, and also how we talked about, if your medication has been, even though it's stored in a right airtight container, if it's been exposed to the flooding, please dispose of it, as how Jessica has mentioned properly. Just maybe really quickly and really briefly, since we actually don't have much time on our show, can you maybe tell us the final advice you'd like to give audiences at home who would maybe experience this?
Okay, so in summary, patients who are living in the flood-prone area should make early preparations the moment they receive information that the monsoon is coming and the flooding is expected. Then the family members play a role in helping the patients as well. So patients need to be compliant to the medications even though they are affected by the flood.
Right.
And if in case there's any doubt about medications, feel free to call our National Pharmacy Call Center at 1-800-88-6722 from Monday to Friday, 8 a.m. to 5 p.m. We are always ready to help.
All right. Thank you so much, Jessica.
Thank you,
Gan.
Erin
Thank you
and
so much,
Brandon.
Jessica Gan. She is a pharmacist from Hospital Kuala Lumpur, talking to us about medication, how you can actually prep yourself better going into the Northeast monsoon period.